Imagine chronic disease, whatever it is, cardiovascular disease, cancer, diabetes, obesity, long COVID, chronic pain. It doesn't matter. Any chronic disease is like a backpack in your shoulders. But your behaviors, your mindset is like a rock that you add to that backpack every single day. And if you make a bad choice, you're adding more rocks into the backpack. If you're making good choices, you actually take the rocks away from the backpack. And this is actually the way I view chronic disease.
Welcome to Ending Chronic Disease, where we challenge everything you thought you knew about health. Join international best-selling author and wellness pioneer, Dr. Fabrizio Mancini, as he reveals how to transform your body, your mind, and your life starting today.
Hi, everybody. This is Dr. Fab Mancini, and I'm so excited to be with you because I wanted to make you aware that I'm on a mission, but I want you to understand the history behind that mission so you know that this is many years in the making. When I was 16 years old, I had a dream that I was going to be a doctor, but I really didn't know what kind of doctor. And I remember that I went to my counselor at my high school, and she mentioned to me that that was great that I wanted to be a doctor, but I needed to really be more disciplined with my studies and only have A's so that way I can get into a great pre-med program. And because of that, I was able to get one of the most prestigious pre-medicine programs in the country at the University of Dallas, in Dallas, Texas. So I came to Dallas, and then the head of that program was a double PhD named Sister Clodovia Lockett. She was very well known in the healthcare system and very famous. And she took a very special interest in me. She only accepted around 27 kids around the world to complete this program. And if you completed it, pretty much you can go to any medical school that you wanted to. So it was very rigorous. There was no time to do anything else but to study all the time. But it taught me the power of discipline. And I can tell you, I loved every minute of it because I realized that the key to being a great student is to actually have a passion for what you're studying. You know, many times I see that sometimes young people go to college or universities, or even adults try to get a second or third degree, but they're lacking that passion. They're lacking that desire of what am I going to do with this? And how am I going to change the world? And what level of impact am I going to have? So for me, learning the human body, how it functions, be able to become the best doctor that I could become was really something else. And I loved every minute of it. And then I went from there to the ability to learn more about the nervous system. Initially, I thought I was going to be a pediatrician, but then I realized that I was fascinated with the nervous system. I learned that if I was just able to put myself in a position where I could impact the brain, that then all of a sudden I was able to help more people. So I asked my counselor and I said, how can I have, and what is the best specialty in medicine that I can become in? She said, well, just become a neurosurgeon. There's nothing longer than that and more intense than that in medicine. So that's what I decided pretty much to go. And then I was involved in a car accident 6 months before I graduated. And the orthopedic surgeon in the hospital, I had severe whiplash. And he said, you know, I can give you painkillers. I can even give you muscle relaxers, but you should go see my doctor of chiropractic. And that's where I was introduced to natural healthcare, holistic healthcare. And I'll never forget that doctor because he reminded me of 3 things that really changed my life during that first visit. Number one, that our bodies have the ability to heal themselves. Number 2, that we have 12 systems in the body, but that the nervous system was the most important system because it controlled and regulated all the other systems. And then thirdly, that they were focusing not only on my symptoms, but they were going to get to the root cause of the problem. And that's when I felt I got the aha moment. Prevention is the key. I interviewed about 62 chiropractors in 6 months. And I went back to my counselor and I said, I'm not going to go to medical school. I'm going to go to chiropractic school. And I chose chiropractic because it's the most established holistic profession in the United States. It's part of pretty much every system. Even though it's still very misunderstood, I recognize that. But I also realized that once I got in it, I was maybe going to be able to help it and educate the world as to the value that it has to offer. And as I was becoming a doctor of chiropractic, I discovered acupuncture. So I started studying more acupuncture and then nutrition, energy medicine, and pretty much everything that had to do with holistic health, natural health. I was a great student. I spent almost every weekend that I was studying to become a doctor of chiropractic in a seminar learning because I was really hungry. I was hungry to become the best that I could be. And then when I went to that first chiropractor, I realized that in the waiting area, they had a few people. And one of the people was a lady that was dealing with infertility. And another one was a person that was struggling with asthma and allergies. And another one that was having digestive problems. Another one that was trying to prevent a disc herniation and they had back pain. Another one that was having some eyesight problems. Well, when I left that office, I was saying to myself, who is this doctor of chiropractic? They must be the smartest people in the world because they just mentioned about 6 or 7 specialties. See, almost 95% of all the graduates of medical school, they go into a specialty in medicine. And one of our biggest challenges in the healthcare system that we have is that it's so fragmented because you have all these specialties and they don't talk to one another. So the patient, every time they have a new symptom, they end up in a different specialty. And that's the maze, especially as we get older. It's really sad to see that our parents and our grandparents are going from one specialty to another, getting medicated for one thing and then getting another medication that may be conflicting with our first medication. It's not the right way to do it. It hasn't worked. It will never work. Let me say it again. It will never work. We've been at this for years and it hasn't worked. Our chronic diseases have escalated more and more every single year. And we need to change that. We need to understand why and how did we get there. So I want you to know that the reason that I want to put myself in this position to continue to guide you in how to end chronic disease is because the solution to chronic disease is you. If you can understand how your body got to be where it is, if you can understand the root causes of that problem, if you can understand and better understand the healthcare system and what drives it, if you can learn from the biggest experts and disruptors in the healthcare system, I know that you will make a better decision. Because at the end of the day, your choices every day is what dictated whether you think of it like this. Imagine chronic disease, whatever it is, cardiovascular disease, cancer, diabetes, obesity, long COVID, chronic pain, it doesn't matter. Any chronic disease is like a backpack in your shoulders. But your behaviors, your mindset is like a rock that you add to that backpack every single day. And if you make a bad choice, you're adding more rocks into the backpack. If you're making good choices, you actually take the rocks away from the backpack. And this is actually the way I view chronic disease. Chronic disease is not a life sentence. We already dealt with that in the early days, in the 80s and 90s, where everybody thought that genetics was the root of all evil. That if all of a sudden your grandparents and your parents had a genetic predisposition, that you were going to get it too. Then we started learning about epigenetics, which is the environment around the cell, your lifestyle choices. And we realized that it was that was activating your predisposition of a genetic disease. So if you change your lifestyle, if you change your life choices, your environment, now you have a better chance to never activate it and be able to break the cycle. And that's really important. Break the cycle. This is a responsibility that we all have. And if you're a parent like me, right, you have the opportunity to break that cycle with your mindset and behavior so your children don't have to live with the same conditions that have plagued your family for years. You know, I want you to know that this podcast is really about empowering you. It's about letting you know my passion, my mission, and why I got into this role since the beginning. You know, they pronounce me as one of the Hall of Famers in the wellness revolutionary movement, people that have contributed greatly to that movement. And then as a doctor of chiropractic, I've been very blessed to not only practice for 10 years, but to have been the president of Parker University, one of our leading chiropractic schools, for 13 years or more. And then now president emeritus of that same university. And they continue to write books and lecture all over. And then, of course, all my media appearances, which have influenced millions of people around the world into how to make better choices. So I want this podcast to be about you. I want this podcast to be relevant and to bring you the latest topics of things that can help you make better choices every single day. And one thing that I've learned over the years is that there is a different paradigm out there. You know, about 20% of the people that I've evaluated over the years have really understood this wellness paradigm and recognized that health is about me and what choices I make and not about the choices of others. But we still have about 80% of the people that are in a healthcare system that is primarily managing symptoms through pharmaceuticals for the most part, instead of engaging you to understand the root causes of your chronic disease. That's the place where we're going to be. My goal is to bring you the best experts in the world, to bring you some of the latest information in science, and more importantly, practical action steps that you can take every single day. I know right now, 7 out of 10 deaths that are happening right now in the United States are actually because of a chronic disease. I lost my father at an early age of 64 to lung cancer. He was pre-diabetic, but he had smoked in his early years. All of that damaged the body to the point that it expressed itself as a lung cancer in the future, and it took him away within a year. I don't want anybody else's parents to die early. It was sad for me to lose them at a young age, and of course, even sadder to see that my children never had a chance to really enjoy them. And I know he would have enjoyed them too. So I want you to know that together we can actually make a difference in this chronic disease. And we want to make sure that you understand that the dream of waking up every single day full of energy and waking every day without any pain in your body and being able to function and do the things you love to do without having to say, no, my body's not capable of doing that any longer. That's not a dream. That's a reality. For the people that subscribe to this idea, and once you hear some of the information that I'm going to be sharing with you, I want you to know that my goal is for you to be that. My goal is for you to be one of those individuals that will allow yourself to live your health potential. Because there's no way that you can ever fulfill your life potential unless you have health potential. Health is the one area of your life that impacts everything. It impacts your relationships at home. It impacts how you feel about yourself, your self-esteem. It impacts your wealth, right? Right now, the number one reason why people go personally bankrupt in the United States has been over the last few years getting sick. A physical illness can wipe you off financially, and we know that. Then we also have the problem that corporate America is having to pay so much money for healthcare costs for their employees that they can't afford it any longer. We know that the healthcare system in the United States is almost 20% of all of our monies. We cannot longer support that. And when I see that 90% of the cost of healthcare in the United States is chronic disease, that's when I decided, let's bring you the podcast that will revolutionize all of that, where you get the experts, where you get the inside information, where you get the latest science, and you get to make the decisions to be healthy. Nothing will give me more joy than for you to be so empowered about this that you're wanting to share that with everybody that you come in contact with. and encourage them to listen to the podcast and sharing those episodes with those that you know in your life are struggling. You see, the one thing about chronic disease is that all of us know somebody right now that is really struggling. It may be us, it may be a family member, it may be a coworker, it may be a neighbor, it may be somebody within your community, but I want you to know that there are answers out there and there are solutions out there, and I'm hoping to bring that to you. I want you to be the most empowered, informed individual out there when it comes to your own health. I want you to make great choices. And I got to tell you, on a practical basis, many times people tell me, Fab, what is the one thing that people can do to be healthy? And for years, I have mentioned, like for me personally, getting a chiropractic adjustment once a week, probably hands down the best decision I made in 38 years. It has regenerated my spine. I don't have any arthritis in my spine. All of my discs are perfectly. I'm going to turn 60 this year. And my body is actually better than it was 21 years old when I started. So I want you to know, to me, that's one. The other one is, of course, the foods that we eat. Right now, over 60 to 80% of all the chronic illnesses are attributed to the foods that we put in our bodies. The foods that we put in our bodies are full of preservatives that have no nutritional value. They just keep the foods living longer in the shelves. Number two, the toxicity in our foods have gotten to a point that now they're having to do governmental regulation even more than ever because of the amount of people that have actually been proven to be sick due to something in their foods, the way they make their foods, the sugar factors, the dyes, the chemicals, the oils that they use to fry them. All of that has already been discovered, but we haven't acted on it as a healthcare system. So with this new administration, I'm hoping and praying that we're going to be able to make some radical changes that will help us all be healthier, especially for our family and our children coming along the way. There has never been this many children with chronic disease ever in the history of humanity. We are seeing all of these chronic illnesses at an earlier and earlier age more than ever. And we must stop that. And I'm included in that mental illness. Mental disease or mental health has become huge in the chronic world. We have conditions like anxiety, depression, suicidal tendencies. All of these things need to get control. We can no longer continue to have that become an issue in our lives. So I want you to join me, but if I was to give you one tip, when people ask me that question, I would say this. I have figured out in 38 years that being healthy, right, ending chronic disease boils down to one simple thing. You making a better choice about your health today than you did yesterday. It's that simple. Take a look at what you did yesterday and ask yourself the question, what is one thing that I can do today that will make it better than what I did yesterday? It may be working out, or maybe working out a little bit longer, doing a different exercise. It may be eating more holistic food and organic food and less preserved foods, less fried foods. It may be maybe having a meditation, a guided meditation where it can actually calm your brain down and be able to allow your brain to recover. It could be maybe sleeping a few more hours a day. Instead of not sleeping well or sleeping 3 or 4 hours, maybe you can sleep 6, 7, or 8 hours. Maybe it's drinking a glass of water with lemon, which many people know is one of the best things you can do first thing in the morning. I just want you to make a better choice, one choice better today than you did yesterday. And then I want you to do it again tomorrow and the next day and the next day. And that is the only way that we can actually be able to ensure that we're going to live longer. We talk about longevity today. Longevity is not about just living longer. It's about living with quality of life as you get older. That to me is what longevity is. And you can do that by making a better choice today. But also giving yourself permission to go see a holistic doctor, like a doctor of chiropractic, a naturopath, an acupuncturist, a massage therapist. These are providers that have already proven the value that they can give your body, especially when it comes to chronic disease. give yourself permission. Or maybe trying some technology like getting a watch that can monitor your sleep patterns and your breathing, or perhaps technology that like red light beds or hydrogen water or brain tap for your brain. I mean, there's so many amazing technologies out there that you can benefit from. So I want this show to hopefully be one that will bring you a lot of that awareness for you to implement. So I want to go on this journey with you, and thank you for being a part of that and allowing me to be a part of that. And my goal is to give you as much information as you can, take at one time, and give you the actionable steps that will help you. So I want you to know that I want you to subscribe to this podcast right now. And I want you to share this episode. If it inspired you, if it motivated you, please share it with somebody that you love. Because the only way that we're going to help our loved ones is that if they get involved in this movement. The only answer to ending chronic disease is that if we begin to take control of our own health. Collectively, we will end chronic disease, or at least reverse it, most of it, right? Because most of the chronic diseases are preventable. And many of them, just like the rocks, if you can just take the rocks off the backpack, you're going to be able to live a pretty decent life. Maybe it's not 100% perfect, but at least you're going to be able to function the way you were meant to function. So the power to end chronic disease, in my opinion, is in your hands. So let's make it happen, one step at a time.
To learn more about Dr. Fabrizio Mancini's groundbreaking work, visit www.endingchronicdisease.com and join the movement. Together, we can end the silent epidemic of chronic disease and create a healthier, more vibrant world. Thank you for tuning in. Until next time, be well and stay inspired.